So what do you do if you come across a person who's very depressed or who's looking sad? Or if somebody tells you that they know a family member who's very sad and or depressed, so what should you do? So the first thing would be to, of course, talk to the person and find out what are the reasons why a person is feeling like that. At the same time, you should also try to find out uh, how sad one is. I mean, is it just one of those passing sadness moments because of failure in an examination or in a sports or in any competition or in a relationship or something like that, or is it something more? When a person is feeling sad without any reason that you can find out, that is even more tricky because that can be a sign of depression. Many times people look depressed, but they deny sadness. And that becomes even more difficult because they will say, no, well, there is nothing to feel sad about, I'm not sad at all, and they will be looking very glum. So what do we do in such situations? It might be worthwhile to find out whether they are enjoying things which they used to enjoy. Now that is a lack of that is another important sign of a depressive disorder. If a person is not enjoying what they were enjoying or not getting any pleasure out of any pleasurable activities is a serious sign of a depressive disorder. So if you find a person who is sad or not sad but is depressed, then we need to help them. It's very important to provide support. Many times just be there. There might not be many things for you to do actively for the person. You don't necessarily have to cheer up a person or brighten up the mood or crack a joke or something or ask the person to forget whatever is happening and then snap out of it. Sometimes these things work, but many times they don't work if a person is having an illness. So it's important to see what can help a person. Ventilation of feelings is very helpful if the sadness or depression is mild. Many times people have nobody to talk to, nobody who would listen to them. And so if they talk about their distress, talk about their feelings, talk about their stress, they might feel better with that. It's also important to find out the other signs of a depressive disorder. Is the person sleeping well? Is the person eating well? Is the person interacting with people? Is the person going out, or is the person withdrawn and staying at home? Is the person getting negative thoughts? Is the person getting depressed thoughts? I'm good for nothing and nobody loves me, nobody cares for me. Or if the person feels that nobody can help me, even I can't help myself, and there is no point of living. A person feels totally hopeless and starts getting suicidal thoughts or suicidal ideas or wishes. Or the person feels that it is better if I was dead. So these feelings are again serious indicators of a depressive disorder. So when we talk about the mood of depression, it is very important to see how persistent or pervasive it is. It's not if a person is sad for half an hour, 1 hour, a day or two, it's not a depressive disorder. But if the person remains sad and depressed for, let's say, approximately about 2 weeks or more, then it's a point of concern. And if the person has other feelings and thoughts which I have just mentioned along with that, then it indicates that it might be a depressive disorder. So the first step would be help from the friends and family and others when it is mild. If a person feels reluctant to talk about it, they could talk to their own doctor, any general physician, or anyone whom you consult for your other medical problems. Or if it is more severe than that, then a person's life is at risk, then it's very important to consult a mental health professional. It might be a psychologist, it might be a psychiatrist, or a person, a social worker or a psychiatric social worker, anyone who can be able to help them. When the depression is very severe and the person has stopped eating, as losing weight, and it's a risk for suicide, it's an emergency. It's a psychiatric emergency, it's a medical emergency. It's important to take the person to not only a psychiatrist but maybe to a psychiatric center. And there might be times when a person might be totally uncooperative or might not consent to give. So it's important to see whether if a person is refusing consent, whether the person is at a risk to self. If the person is at a risk to self, then in the person's benefit, for the person's health, one can take the advantage of the Mental Health Care Act, and take help from hospitals and their facilities, or even police, to shift the person to a psychiatric facility where the depressive disorder, the suicidal risk can be handled. Also remember, when a person is expressing suicidal thoughts and wishes, it's very important to keep them in your field of vision. So that's very important. You keep an eye on the person. Do not let the person be alone where they can harm themselves. There are a number of things at home which can be used, or there can be medications, or there can be pesticides, and or one might like to go on the road and hurt themselves. So there are a number of ways. So it's important to keep an eye on the person and protect the person. A depressive disorder is a treatable disorder, and the suicidal risk, once the depression settles down, can also go away. And you would be surprised how many times people are very, very thankful for your help to them when they were sad and depressed, and for saving their life. Not only they, but their family members would also be very, very grateful for you. So though there is stigma, but there is also help, and it is possible to help a person who has depression or a depressive disorder, or a person who is at a risk for harming oneself, or ending one's life. I hope you would be able to do that to a person who needs you.